When Amanda was 6, she had been at a friend's birthday party, and we were at a gym. So before we left the party, I knew we had to run some errands, so I brought both Amanda and her little sister into the bathroom stall together. And she went to the bathroom, and clearly there must have been blood in the urine because it was all in the toilet bowl.
When a child presents either to the office or to the emergency room and we think they might have a kidney stone, the first thing we do is just get a general sense of their past medical history, do a physical exam, and then we would also get an ultrasound to see if there is a stone present.
A very detailed intake of all of their risk factors, prior medications, whether they take any mineral supplements, whether they have any odd dietary habits.
Whether there's a family history of kidney stones, whether other people, parents, uncles, aunts, grandparents have also had kidney stones.
The family history, that definitely came into play, that I had passed too, and my father had passed them as well.
It hurts really bad. It's a lot of pain in your back and in your stomach, and you can't, like, if you're laying down, you can't stay still. Like, you always feel like you're uncomfortable when it's moving.
It's often associated with nausea and vomiting. Sometimes you may see blood in the urine, but the most common presentation is the child will develop pain.
When the kidney stones are moving down the path, where there are some narrowings on the urinary tract, where the urine gets trapped and the kidney is trying to push the urine beyond the stone, and that's when the pain starts.
We're going to do an ultrasound of you today, okay?
I want to see what they look like.
We've developed what we call an ultrasound first pathway, which is using ultrasound as that initial screening modality to see if a stone is indeed present in a kid.
What's good about ultrasound is that it doesn't have any radiation, so it's very safe and it's not invasive.
It's reduced the exposure to CT scanning, which is a big dose of radiation, by as much as 70% in some cases.
We do a comprehensive assessment of all the possible causes of the kidney stones so that we can then find the best treatment.
Individualized care is critical to the proper management of pediatric stone disease.
It really involves the expertise of multiple different medical specialties.
We've organized so that at one single visit, a child could see a nephrologist who's a medical kidney doctor, a urologist who's a surgical kidney doctor.
We create this seamless interplay between these different disciplines.
Between radiologists, between ER physicians, dietitian,
social workers, psychologists, the anesthesiologists, the endocrinologists, the rheumatologists that are going to be critical parts of your child's care.
I was thankful that they knew exactly what the problem was and exactly how to treat it.
We pride ourselves on being able to diagnose and treat very rare forms of kidney stones, particularly in young children and in older children. But we also stress the importance and understand that the vast majority of our patients have much more of the adult-type stone disease, and we've really specialized in and learned how to treat them appropriately to prevent the number of recurrences.